Kalapa for speaking to us. Deepak Bopanna is still with us right now, I believe. If he is, let me just go back quickly to him. Deepak, clearly Mr. Kalapa pointing out the many issues, the many aspects of the global, I beg your pardon, the COVID fight that Karnataka seems to be struggling with right now. And all this comes, Deepak, when allegations of perhaps overpaying for ventilators, overspending on hospital bedding, all of these allegations are swirling around the Karnataka government, where the health minister says the only God can save us. Clearly, these are not encouraging signals. The people in Karnataka must not be encouraged by this. That's to say the least.
Yes, Athar. Now, at the end of the day, the taxpayer today is not worried about the roads in front of his house. He's not worried about overflowing drains. The least he's expecting today is out of the money that he's paying out of taxes to get good health care during the pandemic. And if that's not happening, that's when the questions arise. The state of Karnataka went into lockdown much before the country did. Then you had, Bengaluru and Karnataka, the numbers much lesser than the other mega cities, the mega states in the country. So you had more time in terms of preparation. So what did you do while people lost jobs? People, took salary cuts. What did the government do in the couple of months that the entire city was shut? In one way, today we're looking at the largest spike in Karnataka yesterday for 4,500 cases and counting. And you're looking at Bengaluru, looking at a massive surge. So they've not been able to control the surge in the cases, and then if you do not really invest in healthcare infrastructure, if you do not maintain the healthcare infrastructure, maintain standards of hygiene, what's the point of preaching to the people to wash their hands or maintain standards of hygiene when hospitals have animals running around them? And it just shows that the apathy is everywhere. The administration needs to be pulled up in the district. The officials in charge of the hospital, the management needs to be pulled up, because the government hospitals should serve as a role model. Poor people cannot afford to go to private hospitals today. There are beds that are lacking in most of the hospitals, and a few that have beds. If this is the condition, then the situation is quite abysmal.
Well, absolutely. This is, of course,